Welcome to the Surgical Skills video series, produced by the Southampton University Surgical Society. My name is Eleonora Dymowska and I'm a core surgical trainee.
And my name is Sahib Rafai. I'm a medical student and 2012 president of the Southampton Surgical Society.
The following tutorials are meant to supplement your learning following attendance at a basic surgical skills course.
We hope you find this video series useful. Thank you for watching. The following tutorial demonstrates how to perform a left-handed reef knot using a technique that minimises the chance of dropping the suture. The left-handed reef knot consists of two throws: a coming down throw and a going up throw. The reef knot has a characteristic figure of 8 appearance. We will now go through the technique step by step. First, hold the long end of the suture with your right hand and hold the short end with your left hand between your thumb and ring finger, like so. Now, turn your left hand over so that your palm faces upwards. Create a gap between your ring and middle finger of your left hand and pass the long end of the suture through this gap, like so. Now, flex your middle finger behind the short end and clamp it between your left index finger and middle finger. Release your thumb and pull the suture through this gap. Now, without letting go with your left hand, hold the suture between your thumb and index finger and turn your hand so that it faces upwards. Create a gap between your left middle and index finger and pass the suture through this gap. Now flex your middle finger behind the short end and clamp it between your left middle and ring finger. Release your thumb and pull to complete the left-handed reef knot.
This following tutorial will demonstrate the surgical instruments used for suturing. We will talk about the names of the different instruments and also how to hold these in a correct manner. We will now go through how to hold your surgical instruments correctly. You will need needle holders, forceps, scissors. Starting with your needle holders. You hold these by placing your thumb and your third finger, stabilizing with your index finger, like so. You open your needle holders by applying counter pressure with your thumb and third finger, like so. Your forceps should not be held like that or like that. Hold them elegantly, like you're holding a pen or a pencil, like so. Your scissors are held similarly to your needle holders, with your thumb and your third finger stabilizing once again with your index finger. And when cutting, it can be advised to use your left hand to stabilize the scissors so as not to tremor, like so. I will now demonstrate how to perform this simple interrupted suturing technique. This is the most simple technique, and if you can learn this, you can advance quickly. I will now demonstrate how to perform a simple interrupted suture, starting with placing the suture in your needle holders. Pick up the needle holders and place it in your hand using the correct technique. Pick up the suture with your forceps. Place your needle holders approximately 2/3 away from the tip of the suture, like so. Begin your suture by placing the needle approximately at a 90-degree angle to the skin. And you want it to go through the dermis on one side, into the dermis at the same level on the other side, and now through the other skin edge at approximately the same distance as you've entered on the previous side. We will now perform an instrument tie. Make sure the suture is away from your hand as not to stick yourself on it. Place your needle holder in the middle of the wound, like so, over it. And you want to place 2 throws over it, like so. And then grab the tip of the other side of the suture, pull it through, carefully as to see the knot being laid down, like so. And then you want to go the other way, once again placing the needle holder over your wound, like so. 1 throw over it, grab the tip of the other suture, and once again making sure that your knot is laid down perfectly over the other one, like so. And make sure your suture is not in the middle of the wound, place it to the side, like so. And then you can hold both of these ends with one hand while using your scissors to cut.